Hey everybody, welcome back to A Brief on Grief. So today I wanted to continue to the discussion that we initiated last time on grief and the impact that it has on men. Again, this is a huge conversation, so with the focus just on men in these few videos, but really it does, when you think of the topic of grief and our troubles with being shamed, being told about how we're supposed to grieve, and then when we don't grieve properly, then we're shamed, and that can cause us to isolate ourselves and disconnect from people, which can lead to a state felt and diagnosed as depression. Again, like I had mentioned in the last video, depression is a huge topic. I think there's going to be ongoing research and study on the complex state of depression. But I'm definitely convinced that unprocessed emotions involved in grief can lead to depression. And of course, men who are socialized to not express their emotions and stuff down their emotions from a very young age, because that's what's being taught to them as what is masculine, then of course they're going to be prone to depression. So today I wanted to kind of talk about how, again, I wanted to actually bring up this book. This is all from this book, I Don't Want to Talk About It, by Terrence Real. This is what I'm referring this conversation to. And in here, he goes into, I've got some notes here because it's kind of complex. So he goes into what he calls the typical depression that we all know, the classic state of depression. He names it as overt depression. So the one overtly open, aware, the one that everybody knows is depression. So that despair, profound impairment, sleep and eating disturbances, irritability, that's what we all know as the classic depression. But what he brings up in this book, which I think is profound, again back from 1997, is that there's a presentation of depression that he calls covert depression. So, and he says that this is like a presentation of behaviors and emotions that hide and mask the symptoms of depression, or what we know as depression, right? So that disconnection, not the disconnection, of course, is involved in the depression we know. But in this covert specific depression, it presents as disconnection or lack of intimacy, workaholism, alcoholism, anger, abusive behaviour, addictions. So as it says on the back of his book, a lot of those things are kind of characteristic of what we see in the male gender sometimes, when they're struggling or whatnot. So he sees this covert kind of presentation as the safer way for men to display when they're struggling, right? So because they've been told that they are not supposed to show emotion, right? And that the one safe emotion for them to express is anger, right? They can express anger and not seen as not manly. So it's acceptable as a man in our society to express anger or use alcohol or work long hours to be less connected. It's more accepted and much less heavily shamed than it is to admit that you're sad and that you're struggling and that you don't feel like being at work and you're losing interest in things and you can't sleep. All those things, those types of feelings that are more commonly expressed in the overt depression state, those are highly shamed in men. They're seen as weak and more feminine qualities. So that's kind of the difference that he describes. And the reason he's bringing this up is that he's saying that he, as the title of the book says, the secret legacy of male depression, he's seen that actually male depression is highly underdiagnosed because clinicians are just looking at the typical presentation of depression, the one like we know, right? And not looking at this covert type of presentation that he says that is what males show. They're struggling and actually they act out and use these presentations and use these behaviors to actually mask the sadness and pain and grief that they have underneath. So, and gender roles plays a huge gender roles play a huge role in this, of course, because we grow up learning what good men and women look like, right? What does a good man look like? What does a good woman look like and act like, right? We're all socialized to be that, and if we don't present like what society thinks looks like a good man or a good woman, then we have shame about that, of not being good enough. So he says that just like depression is underdiagnosed in men, he also says that he thinks that it's overdiagnosed in females. So because females are expected to be more emotional and more openly express feelings, he thinks that that leads to actually people diagnosing, or clinicians diagnosing them with depression more than they actually should be. Maybe they're just expressing their emotions and expressing the pain and stuff that's underneath, which is all very normal and may not be a form of depression at all. But the gender roles, so what's expected, this is kind of complicated. I'm trying to see my notes here. So it is more accepted in our society as a woman, to be sad and to show sadness. For men, it's not accepted. It's more accepted for them to show anger and be overproductive and work hard and have troubles with alcohol and stuff like that. So clinicians are actually led to more severely almost punish the gender that crosses those gender expectations. So if they see a man that's struggling with the more typical overt depression, like sadness and loss of interest in stuff, troubles sleeping, despair, impairment, not able to work and enjoy the things he likes, they will diagnose him as more severely disturbed. And a woman who presents with maybe anger tendencies or is an alcoholic, they will diagnose as more severely disturbed. So in all of this, let me just take a moment, because it's all the same thing. It is a combination of pain from loss of anything, loss of expectation, loss of somebody in your life, disconnection. Really, it's about connection, but that's a whole other topic that I will definitely share on. But just a loss of connection from yourself, your world, due to something that you lost in your life, someone you lost in your life, or a loss of trust and stuff in yourself that goes on forever, right? And the pain and grief that's involved in that. And really, it's about how it's being presented outwardly. And that's what I think these two differences are, is just two different types of presentation of suffering, right? Two different types of presentation of struggling, right? And then how gender plays a role in how it's most accepted to show. That's where the shame comes in, right? It's more safe for women to express it in the overt way, in the overt presentation, sad, and I've said it millions of times, and it's more safe for men to express their struggle and pain in a covert way with covert behaviors. So, but to clarify, there's both overt and covert presentations of depression in both genders. It's just that there's more shame added when the way you're presenting it crosses what's expected in your gender. It's very complicated in a way, but it resonates so deeply with me, and I know partly why this book resonates so deeply with me. I was pulled to it to understand, firstly, the pain that my dad would have suffered, pain my dad did suffer, the trauma that he suffered, and why he had troubles connecting, and why we had troubles connecting. But my soul was also drawn to it because myself, as a female, I inherited trauma behaviors similar to my dad. Anger, aggression, and that's the way I show my pain to the people that I'm the most intimate to and that I'm at the most risk of being disconnected and that's the way I present it. And I always carried deep, deep shame in those behaviors and those emotions that I felt that I had a hard time controlling sometimes. And I realize now that that's why this book and this topic is resonating with me so deeply, is because I am relating it to past trauma. I'm relating it to understanding my dad more and other men that I've had in my life. And because it's helping me understand me more, and it's helping to peel away that shame. And it's when that shame is peeled away, then you have more lightness to choose a different way of reacting to things. And I mean, I could talk forever on this, but this video is probably getting pretty long now. So this is a giant topic. That was just a little introduction on it. So I will end it for today, and we'll see what the next video entails. Okay, take care, everybody. Thanks. Bye.